I believe that when you and I partner our strengths together, and when you partner your strengths across other expertise, especially in the medical field, I believe when you do that, it diffuses the weaknesses. And that became really clear to me when with Carl and I, his strengths and my strengths blend beautifully. As an example of that, at Christmas time, Carl would go in and try to assemble one of the children's toys, a bike, a swing set, or whatever. But I'm the one that drove him to the hospital to have his hands sewn back together. Now, I've told you this is a man with a remarkable IQ, measurable intelligence on paper. But don't let him use a screwdriver. It's a weapon, and he literally would harm himself and need stitches. So we were a wonderful balance in that way. And that's true across all of your different fields. And I've talked about the negative problem I had with the medical profession and not having clear communication. An example of excellent communication and a doctor with spectacular bedside manner, so to speak. I needed more surgery when I lived in Georgia a little less than 10 years ago, and I was sent to Dr. Neil Galloway. His nurse said he gets all the train wrecks, so of course that's where I got to go. Neil Galloway walks into the exam room while I'm still dressed. He's a urologist, okay? Now, normally, gynecologists and urologists, you meet for this first time, and one of you is naked, or as close to naked as you can get. So here, I'm allowed to be fully dressed, and he walks in. He's asking me questions after questions after questions and taking notes. I still don't know how to ask a lot of questions, except now I have Ask Me 3. So Dr. Neil Galloway comes in, asks questions, goes out of the room, and acknowledging the nurse to get me prepped. I get prepped. He does the exam, etc. He leaves the room again, and then he comes back, and then we're both dressed again. That's a peer relationship. That's not a doctor-patient as though one is the silo and one is just this little harmless little person. That's a peer relationship. Thank God. That's taught me a great deal. And this is not peer relationship stuff either. Have you had a prescription in the last 10 years? Do you want to read this to me? The font, I think, is half. It's certainly not 12, which is what I want. And one other issue about Carl, he died 13, 14 years ago. He managed prostate cancer until the last month of his life on Tylenol. When he finally went on morphine, one night he slept through his morphine dose. And when he woke up, this peaceful human being woke up intense, screaming at me, "Get me to the hospital." I'm not dressed, he's not dressed. I immediately realized he needs his morphine dose. I administer that. I'm trying to help him get dressed. Every move hurts because the prostate cancer had metastasized to the hip and the leg. Get him to the hospital. The VA hospital's a mile away. And they take him back immediately because he's in serious need. And I get stopped at the desk. Of course I do, because there's paperwork there. And you know how I love paperwork. And I don't want to see my husband hurt like this. The two attendings, I don't know if they were residents, interns, doctors. They were from a country that does not value women highly. I can tell you that. So I didn't have any mutual respect there. And I'm hearing commotion back here. So I finally left the paperwork and went back. Every IV they're inserting into his arm, Carl is not removing it in the opposite direction. He's grabbing it and ripping it. So there is blood spurting everywhere. A male nurse comes up to assist him and didn't even put gloves on. That's how chaotic that was. They finally get him sedated, but did anyone ask me if he'd had his morphine? He couldn't communicate. His only communication was pain. Did they ask him? I don't know. I feel sure he didn't tell them. That evening, when I was going to go back home because they made no accommodation for me in the hospital room, fortunately we were only a mile away, the doctor calls at 10 o'clock and said, "You have to talk to him and talk him down." I said, "I beg your pardon? This is one of the most reasonable human beings I've ever known. Talk him down?" I get on the phone, and Carl's last words to me that evening were, "But you don't know what they're doing to me at night." So I set my alarm. I arrived at that hospital about 3 a.m. and no security stopped me, and I walk in and he is strapped to the bed. And there is equipment on him so nobody has to clean up. I untied him and I just hovered, wondering how did I let this happen to him. This man had been nothing but gracious to me.